What are the best medical ethics decision-making strategies? Imagine facing a tough medical choice where every option feels like walking a tightrope. How do healthcare professionals and patients decide what's right? That's where decision-making strategies in medical ethics come into play. These methods help us navigate complex moral questions in healthcare, making sure our choices align with core ethical principles. At the heart of medical ethics are four main ideas. Respect for autonomy means honoring a person's right to make their own decisions. Beneficence is about acting in the best interest of the patient. Non-maleficence means avoiding harm, and justice focuses on fairness in distributing care. These principles guide the strategies used to solve ethical dilemmas in medicine. One popular method is called the four-box method. It organizes the decision process into four areas: medical indications, patient preferences, quality of life, and contextual features. Medical indications involve understanding the diagnosis, prognosis, and treatment options. Patient preferences focus on what the patient values and their ability to decide. Quality of life considers how treatments impact the patient's overall well-being. Contextual features include social, legal, and economic factors that might influence care. Another approach is the four-quadrant approach. It's similar but asks specific questions in each domain. For example, what are the medical facts? What does the patient want? How will the treatment affect their quality of life? What external factors are involved? This method helps clarify complex cases, especially when resources are limited or when life is at risk. Some strategies look at the bigger picture by considering the entire healthcare system. These systems-oriented methods examine how organizational policies, social factors, and resource availability influence decisions. They reminded us that ethical choices aren't made in a vacuum but are shaped by the environment and societal structures. Healthcare professionals often follow a step-by-step process. They start by identifying the ethical issue, then gather all relevant facts. Next, they consider the perspectives of everyone involved, including patients, families, and colleagues. After that, they evaluate possible actions and think about the consequences. This systematic approach helps ensure decisions are fair, transparent, and respectful. In practice, these strategies are used during team meetings with checklists or frameworks. Patients and families are involved in shared decision-making, which respects their values and preferences. Regular reviews of past decisions help improve future choices and avoid repeating mistakes. In the end, the best medical ethics decision-making strategies are those that follow ethical principles, consider all viewpoints, and adapt to each unique situation. They help healthcare providers and patients work together to find morally sound solutions that promote trust, fairness, and compassion in care.